Next speaker is Professor Stanislav Blum from St. Petersburg. He present topic facial asymmetry, aging, and posture changes in neuromuscular concept. Please, Stanislav.
I just start my presentation. And so I start. Yeah, my name is Blum Stanislav. I'm orthodontist from St. Petersburg. I have a two clinic. First clinic, it's a dental clinic, Center of Functional Orthodontics and Prosthetics. And second one, it's a general medical clinic, functional clinic, Center of Functional and Anti-Age Medicine. So I want to start with two quotes. First quote, it's a quote of Peter Dawson. You can help people unless you can masterfully diagnose, because people primarily respond to only pain. It's very important because a lot of people have a different functional disturbance of craniomandibular system, but don't know about it. Yeah, because they don't feel any pain. So the second quote, it's Bernard Jenkelson, the father of neuromuscular dentistry. If you can measure it, it's a fact. If you can't measure it, it's an opinion. It's very important point because, in my opinion, the modern medicine have a difference between the medicine of our past. It's in a diagnostics. Yeah, because it's very, very important. Now we live in era of evidence-based medicine. We need some record to measure it. Yeah, if you measure it, you control it. It's very important. So I have a two functional specialization. First, it's functional orthodontics or functional jaw orthopedics or dentofacial orthopedics. The next one, it's neuromuscular dentistry. Really, it's a very, very similar approach, but in neuromuscular dentistry, we use TENS, for example, to change mandible position. In functional orthodontics, I can use different appliance. Yeah. Okay. I want to start with this picture. It's a very old picture of Professor Wilma Simone's functional octahedron. So it's a topic on which we can affect working in functional approach. We can change, and it's our main goal. We can change mandible position. Of course, with mandible, we change tongue position. Of course, we change both TMJ position because it's a part of mandible. So we can't separate these 3 points. So, of course, if we change mandible and tongue position, we influence on neck. It's very important. In all patients, I can't change mandible position without neck. So if I'm aligned mandible, I'm aligned neck in similar way. So if I change mandible position, I change in patient vertical dimension of occlusion. So I change facial symmetry, facial relationship, the sets. So we change facial aesthetics. If we influence effect on neck, we're working with all posture. Of course, we change inframandibular region. It's very important if we're talking about face aging and facial aesthetics. Of course, we influence on airway. It's old picture. I think in a modern, the same. The old topics is the same, but maybe we a little bit rotate this picture and place on the top maybe airway. I think. Okay. So that's why our main clinical direction, of course, it's craniomandibular disorders, posture problem, airway and sleep medicine, and mostly area and sleep dentistry. But the second clinic is general medicine. I have a somnologist in my staff. And at the end, anti-aging dentistry. What is anti-aging dentistry? It's a part of neuromuscular dentistry, or it's a part of functional orthodontics or functional dentistry, when we try to decrease the age-related functional disturbance in craniomandibular region. Okay, for example, very simple case. Before and after, a little bit we changed mandible position, made some build-ups with composite, not so much changes. A little bit better midline. Yeah, we align vertical dimension of occlusion on left and right side. And look how we change facial aesthetics before and after. We dramatically change all lower thirds, the symmetry of lower lip, yes, the mandible line, double chin. Look, the line in the angle of a mouse. In Russia, we called it marionette line. I don't know the original name. Okay. So we change mandible position, we change vertical dimension of occlusion, symmetry, and we can see dramatically changes on the facial aesthetics. Okay, why we now can talk about anti-aging dentistry. If you look on PubMed and print aging face on a search line, you can see the dramatically a rise of a number of publications about this topic. Every year, we have more and more articles, investigation about this problem. I'm not pioneer, of course. We have pioneers. For example, it's a book of anti-aging medical therapist, and we have a chapter anti-aging dentistry and overview to how dentistry relates to longevity and quality of life. Ira Shapira, very famous neuromuscular specialist. Now we understand how our face change in a soft skin per years. Now we have a lot of publication about it. It's not new information. That's why we use a face scanner in my practice, because you know it's very complex to compare two photographs take it in a different time, because in all photographs you have a problem with the deformation, image deformation. Yes, because you have a different type of lens on your photo, and it's the quality of photo, and it's very depend from size between lens and object, light quality, and a lot of different things. Okay, on a face scanner, I have a really 3D information. Yeah, it's image. It's not image, it's object. And I can compare these two objects in a different time period. So we need to prevent age-related changes in occlusion, temporomandibular joint, posture, muscle, sleep, and of course central nervous system, because our muscles ruled by central nervous system, our muscles give to us mandible position, TMJ position, tooth relationship, so it's occlusion, and of course our muscles made our posture. So central nervous system, it's very important. So of course you know everything about tooth aging. It's attrition per years. We lost tooth anatomy, the cusps on posterior teeth, and not only on posterior, on canine. So it's very easy, but you can see that per age we find totally new occlusal anatomy. Not only, and I'm not talking about only teeth. I talk about Monson sphere and curve of Spee. It became deeper, and curve of Wilson. It became totally different. So it's very important when we start modeling the new teeth. Yeah, but now my topic about facial aesthetics, posture, and facial aging. Okay, you know, it's very famous comic actor. It's Ben Stiller. I tried to align to picture by intrapupilar line, so between eyes, and you can see, of course, the muscle disorders, the facial asymmetry, we can see in young years. Yeah, you can see that chin slightly moved on the left, but per years the asymmetry became dramatically worse. On smile, you can see the angulation of upper arch, upper dental arch. Yeah, and in osteopathics books, it's called cranial scoliosis, side bending rotation. It's type of cranium deformation. Of course, in my opinion, not only in my opinion, the muscle disorders, so asymmetrically muscle function, its main problem, main goal of this, main reason of this asymmetry, main reason of this problem. You can find a lot of this information, for example, in this book. It's new book of Massimo Aita, New Posturology, and you can find information not only about posture, but about facial asymmetry. Different type of deformation, and how neuromuscular orthotics can work. Of course, the mandible moved on side of minimal vertical dimension of occlusion. You know about Planck's law, that people chewing on the side with minimal vertical dimension of occlusion. It's very understandable, very clear information. So, but we can find the same information in this very old book. The year of this book, it's 1977. It's Garrett Gelb textbook, and we can find information about muscular chain exists between cranium and shoulder guide. Yeah, and now we can see it on a CBCT image. Yeah. Okay. The line of symmetry, all mandible moved to a patient left, but okay, it's asymmetry on a soft tissue because on the right side we have a bigger vertical dimension of occlusion and a lower side less vertical dimension, and you can see how soft tissue looks different on both sides. On the right side, we can see some jaw line. On the left side, we can see free soft tissue. Of course, it's the same patient. It's the same CBCT, narrow airways. But look, if you look on this CBCT from behind, you can see that that neck region isn't straight. The second clinical case, very big asymmetry. The mandible moved to left. The symmetry on the nose, lips asymmetry. So look on the neck region, the same deformation. Of course, if mandible moved on one side with the tongue, of course, our neck must react on this because this structure is very near. It's connected structures. And what we can find on the neck region else, of course, it's eagle syndrome. Yes, it's elongation of stela hiatus ligament. Very big, very present. So everything what we know about facial aging present on our posture. The functional asymmetry, it's one asymmetry. My patient can't have problem in one region, asymmetry on a cranium region, but totally symmetrical all body. It's impossible. Of course, we know about aging of our posture. Yes, the direction of these changes. This is my new article in journal Aesthetic Dentistry, article about relation of facial symmetry and posture in neuromuscular concept, because all diagnostic here we made on K7. So look, this is a patient in an article. She is an orthodontist, but in other side, she is professional dancer. So everything, of course, her posture and muscle tonus and muscle condition, it's very good. She's very active and very sports girl. But look on her face. Of course, you can see that mandible and lower lip move to the right. Okay. When she smiles, we can see the angulation of upper arch. The asymmetric smile. On it is. I see. I don't have buccal photos in this region, but first class on this side and second class on this side. Okay, first and second. So we can transfer on information in a program and connect information about facial aesthetics, about dental scans, dental digital model, and bone structures. Yeah, we can see our symmetry. Okay. And this is her back. Yeah, it's information from German device DEERS. It's non-rentgenology device. It's a body scanner. It's a back scanner. It's work the same. So, and program based on information of this scan, modeling the form of our vertebrae column. Okay, and on the right image, I connect information from Ray scan. It's a face scanner from CBCT, and then information from DEERS in one system. So I have all body images and connection about mandible position, neck, and all body posture. Okay, then we continue dental diagnostics. So it's axiography, digital. So the right TMJ have a less range of movement. So originally, when she opened a mouth, the mandible moved on the right. So it's all diagnostics on K7, chewing, and electromyography. And you can see that left temporalis anterior muscles work very active. And left masseter 2. Yeah. So I can see muscle asymmetry here. So it's muscle dysfunction. Okay, what I want to do, I need to change mandible position. In this case, I use tense because it's neuromuscular. I work here in clear neuromuscular concept. I find neuromuscular trajectory and record myocentric, the mandible position on a neuromuscular trajectory. Then we model in ExeCAD full anatomy dental orthotics. Yeah, we use mill machine. Okay, now we have two sets of dental orthotics, transparent and tooth color. It's not very important. She's dentist, and we made two pairs of orthotics, but usually we made one. Okay. Yeah, you can see orthotics on the teeth. normal tooth anatomy. It's very important for central nervous system. You have to feel the tooth surface similar like natural. New optic axiography, and now you can see that in mandible opening, the tracks very similar, and the mandible don't move to the right. It's new neuromuscular diagnostics, velocity, not ideal, but looks better. Looks much better, but it's just the first step. Okay, maybe after some time we can find ideal records, but not now. So new electromyography. So you can see that the temporalis muscles don't work so big. Then the main muscle, it's masseter, so it's normal. New mandible position with orthotics, before, after. And new diagnostics of a posture. Look on a shoulder position here. Here it's totally changed. Facial aesthetics. Symmetry much better. A little improvement of symmetric of smile. And we can compare here to 3D scan. Look how we can change. Of course, she don't have any except weight. So this is it's not double chin, it's just a tongue, position of a tongue. But you can see how we can influence on inframandibular region. And I already told to you that it's not only it's not a photo, it's 3D object. And now I can compare very precisely two images. For example, smile before and after. And I can precisely, very precisely, look the difference. Check the difference, compare two images. We can see that all soft tissue of lower jaw move to the left. Now we can calculate changes in soft tissue in inframandibular region, the soft tissue of cheek, lips. So it's lips before. Oh, this is after. This lips before. And it's not similar. Before and after. The symmetric lower lip. This is collecting all information about facial aesthetics, body posture, and electromyography of joint muscles. And at the end, the compare of collected information of facial scanners, CBCT, and body posture. So body scanner, back scanner, German Deers appliance. Yeah. And in the end, small video, I turn off the sound here because last year I add some music in my video. But okay, now we okay, I don't turn on the music because last year the YouTube don't approve show my presentation because I use some licensed video. In originally there are music, maybe you know this song, it's Supergirl. I will not read this information. You can read by yourself it. This is our article. This is our orthodontist. I already talked about this clinical case. So it's a facial scanner. So it's a back scanner. DIRS is a diagnostic complex with bodopodometry, electromyography of neck. So it's just a part of DIRS diagnostics. It's wallowing, 5 scan, change mandible position. You already milling the neuromuscular orthotics, you already know about it. Okay. New posture. It's just a video presentation of my new article and clinical case. Very beautiful girl. So now she have new facial aesthetics, new symmetry, and new posture. Okay, thank you for your attention. I hope everything is okay.
It's okay. Thank you, Stanislav, for your presentation, for your approach and postural and neuromuscular connection. It's very remarkable your view of rejuvenation. Thank you so much.
Thank you.